Sleeping problems, also known as sleep disorders or insomnia, can encompass a range of difficulties falling asleep, staying asleep, or experiencing restful sleep. Recognizing sleep problems involves being aware of common signs and symptoms that may indicate a disruption in your sleep patterns or quality. You may have trouble falling asleep despite feeling tired, spending more than 20 to 30 minutes lying awake in bed without drifting off. You may wake up frequently during the night and have difficulty getting back to sleep. Experiencing restlessness or tossing and turning, you may wake up earlier than desired and find it challenging to fall back asleep. Feeling fatigued or groggy upon waking up, despite spending enough time in bed, you may wake up feeling unrefreshed or unrested, lacking energy and motivation throughout the day. Experiencing excessive daytime sleepiness, fatigue, irritability, which may interfere with daily activities and concentration or your mood. Noticing significant changes in your sleep patterns, such as sleeping more or less than usual, or experiencing disruptions in your sleep-wake cycle. Finding it challenging to concentrate, focus, or make decisions due to poor sleep quality or daytime sleepiness. Experiencing changes in mood such as increased irritability, anxiety, or depression, which may be linked to disrupted sleep patterns. Experiencing physical symptoms such as headaches, muscle tension, gastrointestinal problems that may be related to poor sleep quality or insufficient sleep. Noticing loud snoring, gasping, or choking when you're sleeping. It may indicate sleep apnea or breathing-related sleep disorders. Experiencing uncomfortable sensations in the legs or involuntary leg movements during sleep, which may be indicative of restless leg syndrome or other sleep-related movement disorders. Engaging in unusual behaviors during your sleep, such as sleepwalking, talking, or experiencing frequent nightmares or night terrors. Sleeping problems can have a significant impact on various aspects of one's life, affecting physical health, mental well-being, cognitive function, and overall quality of life. Poor sleep quality and insufficient sleep can lead to daytime fatigue, drowsiness, and decreased alertness, impairing cognitive function, concentration, and productivity. This can affect performance at work or school and increase the risk of accidents and errors. Sleeping problems are closely linked to mood disturbances such as irritability, mood swings, anxiety, and depression. Chronic sleep deprivation can exacerbate symptoms of mood disorders and negatively impact emotional regulation and resilience. Adequate sleep is essential for memory consolidation and cognitive function. Sleeping problems can impair memory formation, learning ability, problem-solving skills, hindering academic or professional performance. Chronic sleep deprivation can weaken the immune system, making individuals more susceptible to infections and illnesses and chronic health conditions. Poor sleep quality has been associated with the increased inflammation and a higher risk of cardiovascular disease, diabetes, obesity. Sleeping problems can disrupt hormonal imbalance, increasing appetite, cravings for high-calorie foods, and the risk of weight gain and obesity. Poor sleep quality is associated with metabolic disturbances, insulin resistance, and an increased risk of type 2 diabetes. Chronic sleep deprivation is linked to and increases the risk of hypertension, heart disease, and stroke. Sleeping problems can disrupt cardiovascular function, elevate the body's blood pressure, and contribute to the development of cardiovascular conditions over time. Poor sleep quality or insufficient sleep can exacerbate existing health conditions and increase the risk of developing chronic health problems. Sleeping problems have been linked to chronic pain, inflammation, and gastrointestinal disorders, and other physical ailments. Sleeping problems can diminish overall quality of life, impacting social relationships, leisure activities, and emotional well-being. Persistent fatigue, irritability, and mood disturbances can affect interpersonal interactions and lead to social withdrawal or isolation. Daytime sleepiness and impaired alertness due to sleeping problems increases the risk of accidents, injuries, and motor vehicle collisions. Individuals with sleeping problems are more prone to drowsy driving and workplace accidents. Chronic sleeping problems are associated with an increased risk of developing a mental health disorder such as anxiety, depression, and bipolar disorders. Disrupted sleep patterns can exacerbate symptoms of existing mental health conditions and contribute to poor psychological well-being. Sleeping problems can have far-reaching consequences such as physical health, mental well-being, and overall quality of life. It's essential to prioritize good sleep hygiene, seek treatment for underlying disorders, and address lifestyle factors that may contribute to poor sleep quality to improve overall health and well-being. Managing sleeping problems involves adopting healthy sleep habits, addressing underlying factors contributing to poor sleep, and seeking professional treatment when it's necessary. If you struggle to find help, go to the link in the description below. Here are some strategies to help manage sleeping problems. Establish a consistent sleep schedule. Go to bed and wake up at the same time every day, even on weekends. Consistency helps regulate your body's internal clock and promotes better quality of sleep. Create a relaxing bedtime routine. Develop a calming bedtime routine to signal your body that it's time to wind down. Activities such as reading, taking a warm bath, or practicing relaxation techniques like deep breathing can help prepare your mind and body for sleep. Optimize your sleep environment. Make your bedroom conducive to sleep by keeping it dark, quiet, and cool. Invest in a comfortable mattress and pillows, and consider using white noise machines or earplugs to block out any disturbances. Limit exposure to screens before bed. Reduce exposure to electronic devices such as smartphones, computers, and televisions. The blue light emitted by screens can interfere with the production of melatonin, a hormone that regulates your sleep-wake cycles. Manage stress and anxiety. Practice stress reduction techniques such as mindfulness meditation, progressive muscle relaxation, and journaling to alleviate anxiety and promote relaxation before bed. Limit your caffeine and alcohol intake. Avoid consuming caffeine-containing beverages like coffee, tea, and soda in the late afternoon and evening, as caffeine can disrupt sleep. Similarly, limit alcohol intake as it can interfere with sleep quality and lead to fragmented sleep. Exercise regularly. Engage in regular physical activity during the day and avoid vigorous exercise close to bedtime, as it may stimulate your body and make it harder to fall asleep. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Watch your diet. Be mindful of what you're eating and drinking, especially in the hours leading up to bedtime. Avoid heavy or spicy meals which can cause discomfort and indigestion. And limit fluid intake to reduce the need for nighttime bathroom trips. Limit naps. If you have trouble sleeping at night, avoid long naps during the day as they can interfere with your ability to fall asleep and stay asleep. If you must nap, keep it short, 20 to 30 minutes, and avoid napping late in the day. Seek professional help. If you continue to experience persistent and severe sleeping problems despite trying self-help strategies, consider seeking professional help from a healthcare provider or sleep specialist. They can evaluate your sleep patterns, identify underlying sleep disorders, and recommend appropriate treatment, such as therapy, medication, or specialized sleep studies. By incorporating these strategies into your daily routine and addressing any underlying issues contributing to poor sleep, you can improve your sleep quality and overall well-being. Remember that managing sleep problems may require patience and persistence, but prioritizing good sleep hygiene is essential for optimal health and functioning.